Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ammar Adly, number ID 2024299482, and I will be discussing about levothyroxine and coffee interactions. This slide will have drug interaction that has drug and food contents and also drug mechanism of actions. It also has drug food interactions that has general interactions and also detailed interactions that contains ADME principle and conduct experiments. It also has clinical consequences for drug effects, contraindications, and adverse effects. And lastly, patient counseling. Levothyroxine has synthetic crystalline L33' 55' tetraiodotyrosine sodium salt, or levothyroxine sodium. It also has colloidal silicon dioxide, lactose, magnesium stearate, microcrystalline cellulose, cornstarch, acacia, and sodium starch glycolate, DNC yellow number 10 aluminum lake, FDNC yellow number 6 aluminum lake. Meanwhile, coffee has caffeine, chlorogenic acid, lipids, phenolic compounds, alkaloids, carbohydrates, proteins and amino acids, minerals, volatile compounds, and lastly acids. Mechanism of action for levothyroxine is a synthetic levoisomer that acts as a replacement for deficiency in thyroxine hormone in the body. It increases metabolic rate and reduces thyroid stimulating hormone secretion from the anterior pituitary lobe. Levothyroxine is absorbed around the jejunum or and ileum part of the intestinal tract. Drug food interactions. Levothyroxine does not interact with the coffee directly. Instead, it is affected by the stimulant effects of the coffee. Meanwhile, coffee, it is believed that caffeine reduces the amount of levothyroxine absorbed in the intestinal tract by increasing the gut motility, subsequently reducing the levothyroxine efficacy. ADME principle discusses about caffeine absorption is reduced by the stimulant effects of the caffeine. So it is reduced. It is also believed that non-caffeine compounds binds to levothyroxine forming complexes. And absorption means less distribution of levothyroxine to the systemic circulation and also targeted tissues. Metabolism. Caffeine may be able to alter liver activity, increase the probability for levothyroxine to be broken down by the liver. Excretion. Increased rate of gut motility reduces the amount of levothyroxine absorbed into the bloodstream, increase the biliary excretion of the levothyroxine. Conducted experiments by Michela Marina focused on the liquid dosage form of levothyroxine and shows no significant difference between them. It can be concluded that onset of liquid levothyroxine will not change when ingested directly with coffee. Meanwhile, MJ Lamson uses tablet dosage form of levothyroxine, and there's a significant decrease in thyroid stimulating hormone, free thyroid and free thyroxine concentrations when levothyroxine is consumed with food and drinks after 30 minutes of food ingestion. And lastly, Camila Silva Perez conducted an experiment on 42 hypothyroidism patients, and it can be concluded that intake of levothyroxine tablets with food can be well tolerated but require more frequent monitoring. Levothyroxine contraindicates with acute myocardial infarction, uncorrected adrenal insufficiency, acute myocarditis, and pericarditis, active cardiac arrhythmias, thyrotoxicosis, hyperthyroidism, pregnant women, and thyroid cancer. Drug effects, it has been discussed earlier, but it also can reduce the size of goiter caused by hypothyroidism. And for the adverse effects of the interactions is poor levothyroxine absorption, uncontrolled hypothyroidism, higher thyroid stimulating hormone, unnecessary increasing the dose of levothyroxine, and also risk of overdose when stopping taking levothyroxine with coffee. Levothyroxine should be taken for oral tablets, specifically on empty stomach, ideally 30 to 60 minutes before eating. Levothyroxine is a lifelong medication, so it should be followed up by regular checkups and blood tests to monitor and manage hormone levels. Patients should report any concerning matters with a doctor, and patients should be comfortable to discuss and question any concerns about the medications. In conclusion, levothyroxine able to help patients suffering from hypothyroidism by increasing their thyroid stimulating hormone levels, as levothyroxine is a mimetic drug. In hindsight, coffee acts as an inhibitor towards oral levothyroxine since it increases the gut motility inside our gastrointestinal tract and reduces the time for levothyroxine uptake inside jejunum and ileum. Thus, it is recommended to take levothyroxine 60 minutes before anything in general. Ironically, this only applies to oral levothyroxine that uses capsules or tablets. Meanwhile, liquid dosage form of levothyroxine is well tolerated, even if it is consumed with food and coffee. This indicates that liquid preparation of levothyroxine are more flexible towards patients that refuses to change their daily routine. That's all from me. This is the reference that I used for the slide. You can pause to see it.